So next up in our topics is to carry on from HIV and how it moves into AIDS or progresses. So AIDS you probably are already familiar with. You've heard about it as you've been going through high school and things, but we'll talk a little bit more in depth about it in the patho. So it stands for Acquired Immune Deficiency Syndrome, and what happens is that as HIV progresses in its final stages, the patient then converts over to AIDS. To convert over to AIDS, they have to meet certain criteria. So they have to develop some type of infection or cancer that's related to them being immunocompromised. Usually these are caused by fungal or viral infections that normal healthy people can fend off. They also have to have a significant drop in their CD4 T cell level. So remember, we're always tracking this in HIV patients to monitor their immune function. If this count goes below 200, then they would be considered to be into the AIDS category of the disease. Common infections that classify them as converting over to AIDS diagnosis is pneumocystic pneumonia, also known as PCP, Kaposi sarcoma, Candida infections, which are also the biomedical word for yeast, so yeast infections, cytomegalovirus, herpes simplex infections, and then Epstein-Barr, also known as mono. So Epstein-Barr can present a little differently in patients who have AIDS. One of the things that they tend to get is a tongue change, and it's known as oral hairy leukoplakia. And what it is they get these white lesions on the sides of their tongue or the lateral aspects. Candida is also common. This is a picture of yeast infection of the mouth, also called thrush. Kaposi sarcoma is a skin lesion caused by a type of cancer that impacts patches of the skin. The abnormal tissues grow underneath the skin and in the lining of the mouth as well. They tend to be red or purple in patches, and they often don't cause many symptoms, but they are painful to the patient. They can spread to internal organs too, such as the digestive tract or the lungs, and cause issues there. So to treat AIDS, ultimately, we don't have a cure. So we can slow down progression and prolong people's lives, but we can't get rid of it. So we ultimately don't want people to get it. So prevention is our primary method of trying to control this disease. Once somebody has it, we target trying to control the viral load or the amount of virus in the blood. And they do that by antiviral therapy. You can see if somebody's been exposed as a risk, if we can start the highly active antiretroviral therapy, then we can limit the amount of transmission or decrease their risk of contracting the disease. It has to be started immediately though, within 48 to 72 hours of exposure. After 72 hours, it's not very effective, and these medications have a lot of risk to them. They're very hard on the kidney and liver. Patients who are on them have to be on them for 28 days at least. So we have to monitor their kidney and liver functions regularly and make sure they're tolerating them. And after 72 hours, the risk of damage is greater than their reduction in the risk of transmission, so we don't usually even prescribe it then. If you, as a healthcare provider, happen to be concerned that you might have been exposed, possibly had an accidental needle stick or some type of medical emergency where you got splashed with body fluids, right? It would be considered an occupational exposure, meaning that you got at your job, and it would be a medical emergency. So you should go seek help from an emergency provider, such as at a emergency room. They would do rapid HIV testing. They try to get it from the source if possible. So they would go to the patient and ask their permission. Now they do have a right to decline. So it's easiest if you know the patient's diagnosis, but if that's not possible, they would test the individual who's had the exposure, and then they'll determine their risk, all right, whether they think it's worth starting treatment, and if they do, they'll start the HAART therapy within hours. All right, it is beneficial to go with a provider who has experience recommending and prescribing these medications since they have so many side effects. Next part of our talk is about fever and inflammation. So fever is usually our first sign that somebody has something wrong with their immune system. It's a sign of inflammation. Your normal temp should be about 98.6 Fahrenheit or 97 to 99.5 Fahrenheit. And if you go with Celsius, it's 36 to 37.5 degrees Celsius. Your hypothalamus is in the center of your brain, and it is our thermoregulation center. So your hypothalamus regulates your temperature. It works by stimulating your core body temperature by using deep body tissues to regulate your temperature. Core means that we're talking about the body at your core, like what your organ temperature is. This is regulated by the nervous system, and that is what gives feedback to the hypothalamus. For instance, when you go outside in the wintertime without a coat on, your skin signals to your nerve endings that your temperature has dropped, and then that signals to your nervous system that in the hypothalamus that you're at risk of dropping your temperature, so it prompts you to start to shiver, and shivering actually makes heat. Now anything that damages the hypothalamus is going to risk disrupting this thermoregulation. So things like head injury, spinal cord injury, those can all impact your ability to be able to maintain your body temperature. Any spinal cord injury above thoracic level 6, people can't control their blood flow or sweating anymore, so they have difficulty cooling themselves. So the medical word for fever is pyrexia. Alright, that is usually cytokine induced as part of our feedback system. Fever is broken whenever we get rid of the inducing agent. So if it's an infection, whenever we get rid of the infection, the fever breaks, for instance. Anything that has a fever higher than 105.8 or 41 degrees Celsius means that the hypothalamus has shut down. And that's a very, very bad sign that our brain is no longer helping to maintain our body temperature. Right? The purpose of a fever is to give us a warning signal, right, that something is off in our body and we need to be careful. That higher body temperature also does other things though. It makes it easier for our white blood cells or WBCs to move around. They can move quicker when it's a little warmer and they get activated faster. Also, you probably know that microbes like bacteria and viruses have a very small window of temperature that they can function in. So by decreasing the temperature of your body, by increasing your temperature of your body, you're actually making it harder for them to grow and replicate. Fever has a direct impact on our vital signs as well. Every time somebody's temperature goes up even 1 degree Fahrenheit, their heart rate tends to go up by 10, which can have a significant impact on their overall homeostasis and workload of their heart. So there's stages of fever, and if you think about when you've been sick, you have probably been through these stages and can relate pretty easily to them. I know in my house we're recently battling the stomach flu, and you could definitely see us going through here. The first phase is known as a prodromal phase. This is when people just start getting that signal, oh, I don't feel good. Like I have a headache, my body hurts, I'm kind of tired, I just want to lay around kind of deal. In the second stage, this is whenever your internal hypothalamus is trying to increase your set body temperature to get those white blood cells moving and to fight infection. This is known as the second stage or chill stage, and it's because people are literally shaking, have the chills. You'll notice they have goosebumps, their vessels constrict and vasoconstriction. What happens is the body's trying to set a new body temperature to be higher so that it can have a warmer temperature to help fight the infection. It's often signaled whenever your pathogen or the pyrogen is in the blood circulation. So if we would take a blood culture at this time, they would be positive and grow the bacteria, the bacteria that's causing the infection. The third stage is called the flushing stage. This is where the body starts to signal that it can cool down. Alright, the antigen is going out of the circulation, things are calming down. So the skin flushes and gets red. This is from vasodilation, where those blood vessels that were constricted are going to open up, and blood flow is going to increase circulation to the surface of the skin, which helps for cooling. The fourth stage is also called the differences stage, and this is initiation of when somebody's fever breaks, you often hear it called, and that's sweating and dehydration is a risk if they lose a lot of fluid through their sweat. kids, whenever we talk about fever in children, they don't have a very good hypothalamus to regulate it, especially infants. So this is why they say you have to dress babies warmly, wrap them, keep a hat on to help them maintain their temperature. Alright, and that's because their hypothalamus just isn't quite mature enough yet. As they get older, this gets better. So in kids, especially infants, any mild increase can cause a signal that there's an infection. So we lower that fever level to 100.4 instead of 101 for them. Alright, so anything, it can be caused by environmental. Alright, so a lot of times if they're especially newer parents who are worried, they're overbundle their kids or overdress them on a warm day. What we would do is say, cool them off a little bit. Take it down the layers, take off the blanket, and then recheck the temperature. If it still remains high, above 100.4, then they should go to a doctor. Alright, and they should get checked for their white blood cell count and a urine analysis or UA to make sure they don't have an infection. They can also show other signs of toxicity because remember most young children cannot talk to you. So they're going to be lethargic, like difficulty to wake up. They may be sleeping more than they are normally. They're not going to eat well. They may be breathing slower and have hypoventilation. And in serious cases, they can actually get cyanosis, which is where their oxygen levels are too low and they're going to have a blue appearance to their lips and face. Fever, fever in the elderly, they're kind of the opposite. Alright, so they have a lower baseline temperature. They run cooler than average adults. Right? Any elevation in them indicates that they have a serious disease. So you need to understand what their baseline is, because anything 2 degrees above their baseline would be considered a fever. And some people forget about this. So for instance, if their baseline is normally 97 and they're running 99, that is a fever and they need to be taken seriously. Right? Most often they're caused by bacteria. Right? And they also respond differently. They can have a change in mental status, have weakness, fatigue, and have weight loss as their initial sign. Right? Next up, you'll pick up with inflammation in the following video.